In nursing education, we're preparing our students ultimately to provide the safest patient care possible. We're also preparing them to achieve success on the NCLEX exam. Our students cannot be practicing nurses until they have passed the NCLEX. So that does heighten the level of responsibility that we have in developing valid and reliable exams. Welcome back, everybody, to Dr. Sellers Educate. If this is the first time that you're tuning in to our channel, welcome. We're glad that you're here. Make sure you subscribe to this channel so that every single time a snapshot is released, you'll be notified right away. And we also want you to print out your study worksheet. You can find that right here in the description. This is going to help you stay focused as you move forward towards achieving nurse educator excellence. We're in the series now where we're talking about exam analysis. Why is it so important? And what is it that you want to focus on as you get ready for the CNE exam? We realize that not every nurse educator colleague, and some of you may be nurses or community members that are watching our snapshot. So we realize that your focus and your ultimate goal may be a little different, but we do want to guide you in a way that is going to align with evidence-based practices. So you all know what's next. That's right, pulling out Billings and Halstead, Teaching and Nursing. You're going to focus on chapter 25 if you're on the journey to CNE, or if you're focusing on being a better nurse educator. This entire chapter is going to include content that we'll be talking about in our series. And today we are talking about item difficulty. Now, if I could see your hands, and I'm asking you to raise them. If you're challenged in that area, I'm sure that I would see some hands. Well, item difficulty is really not that challenging when you follow these evidence-based practices that we're going to talk about. And then the third tip, if you haven't already, is to take a look at our thought-provoking question. We realize that some of you may not have seen it, so we will go over it before we reveal the answer. In today's snapshot, we're asking the question and really changing it into a statement. How do we transform challenging questions on an exam into learning opportunities? Well, we're going to talk about every single step that you need to take to make sure you can change this question into an exclamation point. How do we leverage item difficulty to optimize student assessment? And we also want to foster their critical thinking. Less than 30% of nurses in the clinical setting are using critical thinking skills. We want to be able to align our exam questions, the strategies we're using to validate whether or not learning has happened, with the actual evidence. And when we talk about evidence in this snapshot, we're talking about exam analysis. However, we know there's a lot of different ways that we evaluate whether or not learning has happened. And if you want to take a look at what some of those strategies are, we would encourage you to take a look in chapter 21 as well as chapter 22. This is specifically talking about teaching and learning, and how do we connect those dots for our students? How do we create these cognitive learning experiences for our students that's really going to help them leverage their knowledge, or perhaps be able to discern which gap areas they still have? So here's our first question. What exactly is item difficulty? As you're preparing for the exam, we want you to follow two steps as it relates to all of the questions on the exam analysis. First, we want to make sure that you understand the definition, okay? And then second of all, what is the possible range? And third, if we had to add a third one, it would be that qualitative assessment. What am I going to do with that data now that I first of all understand the definition? So we start at that lowest level, which is remembering, right? Or memorizing information about a concept, going back to Bloom's taxonomy, that lowest level of the cognitive learning domain, as described on page 188 and through 190 in your Billings and Halstead textbook. That's going to explore all three learning domains. But primarily, we talk about and really validate cognitive learning domain when we are developing our exam content. So item difficulty helps us discern between those difficult items and those easier items, those less complex content areas. The optimum range that we're looking for is going to be somewhere between zero point 0.3 to zero point 0.8. Now, the closer we get to 1.0, the easier that question is. So if we're at 0.30, that means 30% of the students chose the correct answer, versus 0.80, that means 80% of the students chose the correct answer. This is a way for us to assess knowledge, and that's how it's calculated using the item difficulty analysis. So why does it matter? All right, so we've talked about the what, which is item difficulty. We've talked about the definition. We've talked about the range. So now why? Why is it important? Well, harder questions, which is that difficulty index below 0.30, can help us distinguish between our top performers, those students that are very knowledgeable about the content, and our low performers, those students that are really challenged to comprehend these concepts. We've talked in a previous snapshot about the discrimination index, right? So some of this content may sound familiar, and that is our focus. We want to be able to help students determine which content area are they not knowledgeable about. This is going to allow them to engage in self-motivation and also leverage the expertise that they need to be able to identify what resources do I need to help me clarify these muddy points? How can I better comprehend this concept in a way that is going to help me make a better patient care decision? This is aligned with Malcolm Knowles' adult learning theory, where we want students to really take responsibility and accountability and be more self-directed in their learning. That requires them to raise their hand, to ask questions, and to engage with us in a way that's going to help them clarify their muddy points and increase their cognitive level and ultimately allow them to make better patient care decisions and to utilize critical thinking as well, which is exactly what's covered on this slide. It helps us assess that higher order thinking. We're thinking about the higher level of analysis, application, and creating. And then we also want to be aware of our ability to align our questions on an exam with real life scenarios. And we've actually developed our thought-provoking question to align more closely with some of these strategies that we're talking about. So let's go back. Now we want to talk about best practices. We want to differentiate ultimately between our students that are not knowledgeable about the content and students that are knowledgeable about the content. That's the goal. And we want to help bridge that gap. We want to fill that gap by engaging in a qualitative exploration of concepts to help students better understand what does it mean to assess a respiratory system, and what am I going to do with that information once I have it. We know there's a huge role from a psychomotor standpoint in students being able to demonstrate it, but we don't want to start in the skills lab, in the sim lab, right? We do not want to start the application and analysis level of learning. We want to engage with our students to reach those levels of learning in our classroom, bridging that theory practice gap, just like Dr. Benner's work describes. So how do we differentiate? First, we calculate what is that difficulty. Thankfully, it's not a manual calculation. You will not need a calculator on your CNE novice, or CNE clinical exam. If you feel like you need a calculator, reread that question, okay? Because there is no need for a calculator. But our exam analysis reports tell us what that difficulty level is for every single question. Next is exam blueprint. That is the first step to helping create reliable and valid exams, is by mapping the level of difficulty based on Bloom's taxonomy, the cognitive learning domain, for each individual question. Even for our first semester students, we do not want the majority of our questions being at that lowest level of remembering, right? We want to engage students in more difficult questions, even in the first semester. And then we go back, right? When we do our exam analysis, we go back and we look at that exam blueprint. If question number 10 was at that lower level and we did not expect a high level of difficulty, then we probably are going to question ourselves if we have a p-value, a difficulty level of 0.20, right? Because that means only 20% of the students chose the correct answer. Okay, so when we talk about exam blueprint, this is about mapping our content to each question, right, on the exam. And also, we want to map to the difficulty level. So thinking about what content in that question have I discussed with my students, and what is the level of difficulty that is most appropriate for this level of student. Let me give you an example. Let's go back to heart failure. You all know, if you've been here before, cardiac is my area of specialty, so that's the area I tend to focus on. If I have just completed a 4-week session of talking about the cardiac and respiratory system, and these are my first semester students, I know that they should have a good understanding now of what a systolic and diastolic blood pressure is. I also expect them to know what happens in the heart whenever a systolic blood pressure is high, what's going on. And I would expect them to know what are going to be some of the interventions that I can expect as it relates to a patient that is hypertensive. What I may not expect them to know is the blood flow through each of the valves of the heart and how that is going to be affected based on medications. Okay, so you want to think about what level of comprehension do I expect my students to have based on the content I've taught in the course and the learning objectives that have been mapped back to each of those exam questions. Okay, and if you need further details around exam blueprint, that's going to be chapter 25 as well. That's where you're going to see an example and going into a deeper dive related to exam blueprints. We also want to promote critical thinking. In the example that I just gave, we want to have a conversation with our students during the exam review, and we want to talk about care of the heart failure patient, care of the hypertensive patient, to better understand where did that student get lost? Where did I lose them? Where did they start to kind of fade out and not connect the dots completely? And then quality exams. I'm going to, first of all, take that first step as Billings and Halstead describes, to develop a valid and reliable exam by developing a blueprint and making sure that I am mapping to the content and the learning objectives for my specific course. All right, so those are some key steps that you want to take when you think about how am I going to focus on developing a valid and reliable exam and feel confident that my students are knowledgeable or they are not knowledgeable based on the exam results. All right, so let's wrap up and looking at our thought-provoking question. So a nursing educator is reviewing an exam question on heart failure management and notices that only 30% of the students answer the question correctly. The question is as follows. A 68-year-old patient with a history of CHF is admitted to the hospital with complaints of shortness of breath and fatigue. The nurse assesses the patient and finds bilateral pitting edema in the lower extremities, crackles in the lungs, and an oxygen saturation of 88% on room air. The patient is prescribed furosemide Lasix IV. What is the most appropriate action the nurse should take after administering the medication? So here's the question, right? So we've given you a lengthy scenario. Now remember, these are thought-provoking questions. Okay, so we just want you to think about the content you have been given in this specific question. And what the question is asking you, which is the second part you want to think about for all of your questions on the C&E exam. So based on the item difficulty and item analysis principles, what is the most appropriate next step for the educator in evaluating the effectiveness of the question? So we know p-value difficulty is 0.30. So aside from the fact that you've been given this wonderful scenario, which again was only integrated to align with the fact that we want to integrate realistic scenarios as much as we can in order to validate knowledge, to engage in this cycle of learning that we want our students to have. All right, so you can think about what is going to be the best answer based on these three options. All right, so now we've read the question. Now we're ready to go to the three options. A is lower the cognitive level of the question and focus on basic recall. B, conduct a discrimination index analysis to determine if high-performing students answer the question correctly. Or C, remove the question from future exams due to its low difficulty index. All right, so I'm going to give you some time now that you see the three options. And if you chose B, you are correct. So give yourself a round of applause if you chose B. Conducting a discrimination index analysis to determine if high-performing students answered the question correctly is the correct answer. And when you think about the other two options, if it's a muddy point for you, you're not sure why, reach out to us, info@drsellerseducate.com. But we should always focus on how can we improve the quality of our exams. And in conclusion, we're using item difficulty analysis as another indicator to determine are students comprehending the concepts. If not, we want to think about how can we remediate and better support our students. Thank you for watching this snapshot, and we look forward to seeing you in the next one, and we hope you have a great day.